I always wanted to become a nurse because when I was younger, I was taking care of my aunt and she was diabetic at a young age. So I had to administer her insulin and taking care of her. So that made me want to become a nurse so I can help people, educate people.
I always wanted to do something in healthcare. I had a chance to take care of my grandpa when he was sick. He was elder, and it's been kind of like a call. Caring for people, you get to learn a lot. You get to kind of step into their place for a moment and reflect.
Well, becoming a nurse is something I want to be since actually high school. And then years later, my parents both kind of separately became ill, so I kind of had to take care of them. I enjoyed taking care of my parents. I enjoyed, like all the medical care, the terminology, and I was learning a lot just taking them to the doctor's visits, hospital, and I just went back to school and it worked out. Here I am.
So I chose Northwestern Medicine, Marion Joy Hospital, because of its excellent reputation. And, I'm gonna have a moment of emotion here. I have a son who had a traumatic brain injury, and he spent 6 weeks here. My husband and I often say that Marion Joy started our journey toward home. The care was just amazing, watching the nurses and the therapists and the doctors and how they worked together. And the next thing I knew, I was a part of this amazing team.
I remember working with a patient, and it happens to be Nancy's son. And now I'm working with her, so it's nice to have that connection with Nancy.
I've been here 10 years now, and the teamwork aspect of Marion Joy is kind of what keeps me here. Everybody kind of works as a family. Everybody knows each other well.
I love my team. We are a working family. We rally around each other. We embrace interdisciplinary care and collaboration because evidence has shown that gives the best, most thorough care to the patients.
We have residents which are delivering care that are at Marion Joy 24/7. You get the best support to help you really understand what your role is and what you can do. And when you look around the patient, how they are cared for, you know that this is a good place. You know some place is a good place when you know, if I'm not feeling well, I'll come here myself.
The most rewarding thing about being a nurse at Marion Joy is helping people on their journey. We give them the tools they need so that eventually they can return to the community and back to their lives.
We see patients that show up here not able to move, not able to do anything.
They are bedridden, they are not doing so great. The time goes and we see the improvement, and by the end of their treatment, they are probably walking on their feet and going home. That's our goal. So to be able to see that, that's most rewarding for me.
When it comes to benefits, we have the whole package.
You get tuition reimbursement. They encourage you to get more certifications.
The pay is very competitive.
We have a very good matching for 401k. We have health, we have dental, we have vision.
Northwestern Medicine Marion Joy has applied for magnet status. It means making sure we're using evidence-based practice in everything we do, and that's constantly evolving and updating so that we can give patients the best outcomes.
It gives me confidence that I'm working for a facility that cares about their patients and is constantly evolving to stay on top of their game.
I love the fact that I'm able to change someone's life just by educating or listening to their concerns, or just even smiling sometimes just makes their day.
When they come to us, they're kind of at what could be one of their lowest points in their life, but then they come to us, we get to see them get better, and most of the time we actually see them go home. Kind of makes me happy.